At the end of this episode, you should be able to clinically define capacity, describe interview techniques which may be used to assess capacity, and understand diminished capacity may be caused by a variety of pathologies.
So clinically, the concept of capacity is evolving. Only recently we have been able to really standardize capacity and what it means. Capacity is a concept where a person needs to evidence several things. Basically, needs to be able to show several areas of competency, if you want. The first thing we ask a person is whether they have if they can make a decision. So a choice is the first criteria for capacity. Do you want to go to the hospital or you don't? If a person says yes or no, then they meet that first requirement. The second requirement for capacity is whether the person understands what you are saying to them. So if I talk to Mrs. Jones and I tell her, Mrs. Jones, you need to be in the hospital because your blood sugar is high. If Mrs. Jones is able to repeat that and say, I understand what you're saying, my sugar is too high, that's enough to meet that second requirement of understanding. That's not enough though. Mrs. Jones needs to be able to say that she has an illness, that she has diabetes. Do you understand that this is a problem that you have? If Mrs. Jones realizes that, then she meets the third criteria, which is appreciation. So Mrs. Jones appreciates that she has an illness and appreciates that this illness can cause her blood sugars to go high. And then if a person is refusing treatment, they need to show that they are making some kind of rational decision making. I have a DNR already signed, I'm 85 years old, leave me alone, I've had this before, I'm really not interested in going to the hospital. That's a person who is showing some kind of reasoning process. It doesn't have to be reasonable, and that's an important piece. It doesn't have to be reasonable, but it's a reasoning process that they're making. So in the field, we are not asking EMT providers to really do a complete evaluation and an hour interview with patients, but we are asking them to show some kind of decision-making process as to whether that person is showing confusion. Are they able to interact with you? Are they able to tell you why they don't want to go to the hospital? If there's any concern, in the field as to the mental status of the person, as to whether the person is oriented, as to whether the person understands that they have an illness, the consequences of their decision, then that person, if there's any question about that, that person needs to go to the hospital for further evaluation.
To demonstrate capacity, a patient must be able to communicate that they understand there is a problem, understand why that problem is concerning, and make a decision as to their care, and be able to rationally justify that decision.
First and foremost, there's your assessment, because you have to rule out those altered mental status and other kinds of problems. First, you really do have to fully assess the patient, first and foremost. So you use those skills, which are our usual, and part of that is just talking to the patient. Do they know who they are, where they are, what time it is, and what the situation is? And the situation is what just happened. A car crash, a fall, a series of events that led up to you being called to that scene, which gives you their level of consciousness and some understanding of their surroundings and their problem. And that's the first part of that decisional capacity piece, is do they understand what's going on now, what the medical problem is, and what the consequences of the decisions you're asking them to make. Do you want to seek further treatment and be transported to a hospital? If not, what plan can we put in place, etc. So those are a series of pieces. In that whole conversation, I will ask the patient if they're sounding like they don't want further treatment and I want them to have that further treatment. We'll ask them, can you tell me back what my concerns are about what's going on? Can you tell me why it is that you want to refuse further treatment and transportation? Sometimes it's a, oh, gee, I have an appointment and I feel fine, and we have to go over what my concerns are again. In other cases, it's a child and we have a parent coming, and the parent will be able to make that decision, perhaps taking them to the pediatrician or some other acceptable safety plan.
One technique I would suggest would be to first to ask the person what they want, that to meet the first criteria of choice. You want to know whether they want one thing or another. The other important piece during an interview is to do a quick orientation check, asking about time, date, orientation to persons. Who is that person next to you? Can you give me his name, her name? Where are you right now? What's the date? What's the time? Can you tell me what's going on? During that quick interview, an EMS provider can assess whether the person understands that they have a problem. Do you understand what would happen if you go to the hospital? Do you understand what would happen if you don't go to the hospital? And determining capacity based on those 4 criteria. Choice, orientation, understanding of the illness, understanding of what would happen with one choice versus what would happen with the alternative choice.
Tips for a capacity assessment. Use your initial evaluation, interview for orientation, ask the patient to verbalize the provider's evaluation or concerns, and ask the patient to communicate the evidence they are using to make a treatment decision, particularly for refusals.
Many of the clues that you get, you learn to interpret because of your experience. And it's one of the hardest things that we teach new EMTs coming into the field, is to do a really good assessment, looking for those medical causes, because we always assume we start from the place that there's a medical cause first. And once we've gone through our assessment and gone through the interview and reasonably ruled those out, then we're left with, okay, does this person who is seems intoxicated, or at least ataxic, is stumbling around, are they truly drunk, or is there something else going on? We've all had calls, if you've been in the field long enough, where you're surprised. You find a BG of 30. Oh, okay, I know what this is. Let me go there first. You again need to use the clues from your assessment. You need to use the clues from your interview. Often asking, have you been drinking tonight? I am routinely amazed at how much my patients will tell me about illicit drug use and alcohol use simply by asking them. First, you have to join with them. You have to create that alliance that I'm here to help you, and we need to have a bit of a rapport going here. And you do that in your beginning of your assessment. But then when you get down to the harder questions, they often will tell you, maybe not an accurate amount, but they will often tell you how much they've been drinking. And you can talk about, is this something for which you've been seeking treatment? Is this a problem for you? Or do you have other services, for example, mental health services? When they talk about their providers, their doctors, or if they have their medications with them, and you know some of the psychiatrists in town, you can also use that as a clue.
To better understand the cause for a patient's diminished capacity, assume the condition is due to an emergent medical cause. Directly ask patients about drug or alcohol, and a patient's medication history may show a psychiatric cause.